Okay, we are going to look at the horizontal necklines. So in her case, they are quite long. They start from here and continue like this. And I see something here. Maybe you can put down your chin a little bit. Yeah, a little bit further. Yeah. So it's good to visualize, you know, exactly where you want to be. And as you can see, there's quite a number of them. And so what we're going to do is we're going to use a 50-50 dilution of calcium hydroxyapatite because it's a very thin skin. And then we have a product that has still a little bit of viscosity left, but it's fluid enough for us to be able to even it out properly with some manual massage after the treatment. So this is a very, let's say, basic technique, retrograde linear threads with a 27 gauge needle. And I'm just using the needle that was supplied in the package. It is the 27 gauge 2 centimeter needle. So I'm gonna go ahead and start the treatment. So I put in the needle from here. I stay very superficial, so it's basically 1.5 millimeters below the surface of the skin, and inject small amounts, 0.05, something like that. This is how I learned it from Dr. Chow from Taiwan. He was the first one to actually publish this, and I'm using his technique. It's working quite well. And especially the long term, if you see the patient after about 3 months, you'll see that there's a significant difference in these horizontal necklines. So every retrograde is about 0.05 milliliters. Of course, you can also use a cannula. It's a little bit faster to use a needle. Usually bruises a little bit more. Now you see there's a little bit of a visible deposition, so I am immediately taking that with my fingers and rolling the skin between my fingers in order to even out the diluted calcium hydroxyapatite. So remember, this is a 50-50 dilution, so 50% of what I'm injecting is actually water. And therefore, I'm not too worried when there's a little bit of a bump or a visible deposition, because I know that it's going to be reduced just by resorption of that water, but also because of redistribution. Because the product right now is so liquid with such a low viscosity and such a low elasticity, I know that after injection, it is going to also spread by itself. That would be a different story if I would inject the non-diluted product. That would probably stay in its place and result in, let's say, very visible sausages, visible depositions of retrograde linear threads. So therefore, it makes sense to use this 50-50 dilution. Of course, the danger zones in the neck are the deep arteries, the common external and internal carotid artery, and superficially we have the jugular veins. So the jugular veins are usually like this, and those are the ones that can give you the big bruises. Of course, we're never going to reach the deep arteries with this technique because we have a very horizontal approach. So you see here this entry point. Let's see. I go in with the needle quite horizontally. I advance. So the risk of the chance of actually getting into the carotid artery is extremely low. Of course, we have to be aware of the carotid arteries, especially internal, because that has a direct connection to the brain, and we don't want to be injecting this product into the brain, of course. So we have to make sure that we stay just at the dermal-subdermal junction. All right. Now, after injecting, I will give some massage. And what you could do if you feel like there's a little bit too much of a deposit somewhere, make the area wet. Take a nail and start, let's say, scraping your nail of your thumb or your index finger over that deposition in order to even out the product, in order to flatten it, to redistribute it. And another possible technique is to just pinch the skin and roll the skin between your fingers in order to even it out further. Might be a little bit unpleasant for the patient, and so just keep an eye on how she reacts. If there's any dry masses, maybe you want to use a little bit less force. So I'm going to continue on the other side with 1-to-1 dilution as well. I'm just following all the superficial horizontal necklines with diluted calcium hydroxyapatite. And so, step by step, improving these wrinkles, and the optimum result will be, I think, in about 6-7 months. There is a significant collagen production visible after 2-3 months. And that will continue. So finally, the maximum amount of collagen will be about 7 months post-procedure. So I'm going to continue from here. And here. You see, I'm really careful where I know that these jugular veins are, and so I'm staying superficial. Where I know that the product has the optimum effect, as close as possible to those fibroblasts in the skin. And of course we see a little bruise here. This is all part of the deal. Superficial injection with the needle equals a bit more risk of bruising. But of course this ecchymosis will go usually within a week, and it's very easy to camouflage it. And over here, the last line. There we go. Deep dermis or dermal-subdermal junction. Probably is just below the dermis, because it's so thin here that I'm not even sure if the needle would actually fit inside the dermis. So I'm about 1 to 1.5 millimeters deep here. Very superficial, as you can see. And that's exactly where we want the product to work. That's where we need the neocollagenesis and the effect. All right, so we're actually almost at the décolletage level, and that is where I will be continuing. After a certain amount of time, as you can see here in the previously treated neck, you can see that there's also some white discoloration. Apart from some bruising, there's a little bit of white discoloration, and that white doesn't mean that there's any vascular event, but it shows that there was adrenaline inside the lidocaine that was used for mixing through the calcium hydroxylapatite. So there's just a vasoconstriction based on adrenaline. All right, that concludes it.